Nutritional Recommendations and Food Requirements of Expectant Mother, Chapter 8. Those who have textbook, it's from page number 143. Those who have the latest edition of dietetics textbook, page number may slightly vary. So please describe the page number in the chat box. If anyone is joining late, please help them out with the chapter name or page number. Those who have not received the textbooks yet, just check the class how it is going on. You may find it slight difficult without textbook, but once the textbooks are delivered, you will find it much more easier to follow up with the presentations. So we'll start today's session. So nutrition before and during pregnancy, even before, if you're planning to get pregnant, okay, before pregnancy, okay, preconceptional nutrition is also very important, okay, and it has a very good potential for a long-term health impact on the unborn child and also on maternal health for both, okay. But pregnancy comes with a lot of physiological changes, okay. A woman's body changes a lot, adapts a lot during pregnancy. And obviously, her nutrition, the food that a pregnant woman eats, has to keep up with the growing requirements and needs of a mother's body as well as of developing fetus. Okay, both the lives nutrition has to be taken care during pregnancy. Okay, so we'll discuss physiological changes during pregnancy in brief. Okay, those who are from a medical background, you must have learned this extensively at anatomical and physiological level. Okay, but only just for a briefing so that others have an idea what kind of changes we are expecting during pregnancy. Okay, so your blood chemistry, the blood a human being has, it's almost around 2 liters, okay, an adult, normal adult has around 2 liters, 1.5 to 2 liters of blood, at an average, okay. That could, it could be more than 2.5 liters as well, based on how much hydrated your body is, okay. But during pregnancy, the blood volume doubles, okay, and it reaches more than 2500 ml, almost doubles, okay. That also by the last trimester. Pregnancy is divided into 3 trimesters: first, second, third, 3 month each. The first 3 months are first trimester, then the fourth, fifth, sixth is the second trimester, and seventh to ninth month, or till the 10th month, it is the third trimester. Okay, pregnancy is divided into 3 trimesters. So blood chemistry, blood cells, number of blood cells increases, okay. RBC, plasma, platelets, WBC, okay, all these blood cells increases. So iron requirement should never go down because you have to make a lot of RBC, okay. Protein requirement cannot go down because you have to make a lot of lymphocytes, okay. Increased clotting factors, that is platelets, okay. Increased fibrinolytic activity. Even a small cut or bruise will be immediately, it has to immediately heal, okay. So a lot of clotting factors, blood coagulation and clotting factor increases, okay. High risk of iron deficiency and anemia happens during pregnancy because your blood volume is increasing. Definitely the blood volume will increase, but if the RBCs, if the formation of RBC is not able to keep up with a huge amount of blood volume, definitely the mother will be anemic, okay. You will have a lot of blood, you will have a lot of plasma, but you don't have enough amount of RBC, definitely the person will be anemic, okay. At cardiovascular system, your heart and vessels, blood vessels. 1 second. So your heart, tachycardia. Tachycardia means the heart beats increases. Okay, per minute. Per minute, the heartbeat increases. It's when it is more than 100 or 120 per minute, we consider it as tachycardia. Okay, increased cardiac output, the rate at which heart is pumping the blood. Okay, the amount of blood as well as the rate at which the heart is pumping out blood increases, because now the heart has to pump out a whole lot of blood. Blood volume has increased. Okay, so the heart is overworked. It has to pump a lot more, and aggressively a lot more has to be pumped out. Okay, then at the respiratory system level, increased stroke volume, that is increased plasma volume. Okay, the uh, blood plasma volume increases a lot, that is increased stroke volume. Then respiratory system. Okay, diaphragm is displaced. Diaphragm is a sheet of muscle. Okay, and diaphragm separates your chest cavity from your abdominal cavity. Diaphragm separates your lungs. Okay, lungs is in your thoracic cavity, that is your chest cavity, and abdominal organs, your stomach, liver, etc., they are down. Okay, so diaphragm is a sheet of muscle that separates your thoracic cavity and abdominal cavity, chest cavity and abdominal cavity. So when the child is growing, okay, when the child is growing, fetus is growing upwards. Okay, uterus will also grow along with the fetus, and uterus will displace all the organs, abdominal organs upwards. Okay, because now the uterus requires more space. So all the abdominal organs will shift upwards, and in that pressure, diaphragm will also shift more upwards. Superiorly, it will shift. Okay, so definitely the lung space, the space that the lungs have, will decrease. Space that the lungs have in the chest cavity will decrease, and because of that, respiratory issues. Okay, not able to breathe properly when sleeping. Okay, these kind of issues. Orthopnea, we say that orthopnea, when lying down straight, you're not able to sleep properly. So these are the changes in respiratory system. The decreased functional reserve capacity, oxygen capacity decreases, risk of apnea, breathlessness, dyspnea, difficulty in breathing, okay, hyperventilation. Use take a lot of inhale a lot of breaths. Okay, within 1 minute, at least 16 to 25 times a normal person will take in the breath. Okay, when you are having hyperventilation, it's more than 30 or more than 35 breaths per minute. That is hyperventilation. Next, you have gastrointestinal system, and that is definitely nausea and vomiting is pretty common in pregnancy. And when during the last trimester, okay, third trimester, when the baby is growing, still growing, and pushing all the organs upwards, okay, pushing all the abdominal organs upwards, the baby will be pushing the stomach also upwards superiorly. Okay, so because of that, the stomach acids can easily spill into the esophagus, because it is getting squeezed. Stomach is getting squeezed. Okay, so the stomach acid will easily spill into the esophagus, and because of that, mothers may suffer from heartburn and acidity. Okay, because the stomach is also getting squeezed. And general changes, mood, behavioral changes. Okay, um, hyper emotional, okay, increased nutritional demands that we will learn in the coming up slides. Okay, so these are the major changes during pregnancy at every systemic level. Urinary system they have not mentioned, but uh, the mothers will slowly at by the end of second trimester, when the third trimester starts, the frequency of urination increases, okay, because the cardiac output has increased, there is a whole lot of blood plasma available, okay, risk of edema and all, the frequency of urination increases, okay. Every now and then the mothers may have to go and visit the toilet for urination. Is it clear to all? Major changes during pregnancy, physiological changes during pregnancy. So coming to role of placenta. So placenta you can see here. Placenta is a vital link between the mother and the growing baby. Okay. The nutritional requirement to the child reaches through placenta. The gas exchange, oxygen, also reaches the child through placenta. Whatever the waste that the child is producing, whatever waste the child is producing, that is getting into the mother system, and through the mother system it will be out of her body. Okay, that is also that exchange, waste, nutrients, oxygen, gases, hormones, okay, immunity, these all are exchanged through placenta. Okay, so placenta is the link between the mother and the child. And any adverse influences during pregnancy, like smoking and all, that can also impact not just the growing child, but also the third generation. Okay. So just imagine a mother who is smoking or is indulgent in any drinking activities, alcoholism, drug abuses. Okay. If mother is into any substance abuse, so consider mother as the first generation. And if she is pregnant, the fetus will be the second generation. And inside the fetus, let it be a male fetus or a female fetus, both have reproductive cells. Okay, so that those reproductive cells will also get afflicted. Okay, so the third generation is also getting affected. So when a mother is having some certain bad habits like smoking, alcoholism, drug abuse, okay, obviously her body is affected. Okay, these have deteriorating effects on the person's body, but also the growing fetus. If she's pregnant, the growing fetus will be affected, and also inside the growing fetus, reproductive cells are getting mature. Okay, those are also getting affected. Okay, when the child is born, when once the child is born, the maturation of the reproductive cells stops, and the continuation of this maturation will start in puberty. Okay, for males and for females, for a male child and a female child, inside the mother's womb the cells get mature. Okay, and the second cycle of maturation that happens during puberty. Okay, first cycle of maturation happens inside a mother's womb. Okay, so placenta size is also compromised when a woman has a small pelvis. If a woman is underage, usually teenage girls, okay, when they get pregnant, their bodies are not completely developed. This is the reason why. Okay, by the age of 20 and 25, your skeletal system is completely developed. Okay, when you are since still in a growing phase, you're still a teenage child, your body is not completely developed. Teenage girls will have a comparatively smaller pelvis as compared to adult women. Okay, so if there is a small pelvis, placenta size will be small. If the placental size is small, the exchange of nutrients, waste, oxygenation to the fetus and between the mother will be also compromised. Okay, if placenta has a good surface area, a good amount of exchange will take place, and the growing fetus will be healthy. Okay. Even undernourished girl child, okay, they also suffer from small placenta. And placenta also secretes and produces certain hormones which are required for regulating the fetal growth and development, and also to support the mother, also to produce additional immunity to the mother. Coming to preconceptual nutrition. Preconceptual nutrition means a woman is not pregnant yet, but she wants to get pregnant. She's planning for a pregnancy. Okay, this is preconceptual nutrition. Okay, a woman who is well nourished even before the pregnancy, okay, she will start her pregnancy with good reserve stores of nutrients in the body to support the growth of the fetus. Okay, and that will not, the child will, there are high chances that a healthy woman, even before pregnancy, if she was healthy, she was not suffering from any deficiency. Okay, her the success rate of fertilization, the rate of a healthy conception, okay, and healthy gestational period. Gestational period means the entire time duration when she is pregnant. Okay, a healthy uncomplicated gestational period, there are high chances, okay, when mothers are healthy, high chances that she will have a healthy uncomplicated gestational period. Okay, and also infants who are well nourished in the womb, they have a enhanced chance of entering life with good physical health, good mental health as well. Undernutrition during before pregnancy, during pregnancy will definitely affect the fetus's growth and mental development as well. And usually a woman who is whose diet is adequate even before she was pregnant and during her pregnancy, she maintained a good nutrition, high chances that she will bear a full term baby, not preterm baby. Okay, a full term viable infant. So the any women who are suffering from infertility, okay, nutritionally how you can boost it, it will not cure, nutrition will not cure your fertility, but how fertility can be boosted with certain nutrients if you're planning motherhood. Okay, so make sure your iron reserves are well, magnesium reserves, folic acid, essential fatty acids, omega 3, omega 6, calcium. Okay, and it is understood that mothers who weigh less than 40 kg. Okay, 40 kg is used as a cutoff limit. If any mother is less, or any woman whose weight is less than 40 kg, it's understood that she will there are high chances that she will give birth to a low birth weight baby or small for gestational age baby. LBW means low birth weight. SGA means small for gestational age babies. Okay, in both the cases, the children are not physically well developed in terms of their height and in terms of their length and weight. Okay, based on whatever age they are. Okay, that is small for gestational age. Low birth weight means they were born with birth weight less than 2.5 kg. Okay, so low birth weight has various other categories also. Very low birth weight, very low birth weight. Okay, extremely low birth weight. Okay, these are the different categories of low birth weight babies. Usually, if the child's weight is less than 2.5 kg, it is considered low birth weight. If the child's weight is less than 2 kg, very low birth weight, or less than 1.5 kg, very low birth weight. Extremely low birth weight is a child who is weighing less than 1 kg. Okay. So coming to the nutritional requirements during pregnancy, energy is increased, the kilocalories, okay, the kilocalories that a mother takes during her second and the third trimester is increased. Okay, usually during the first trimester You don't have to increase your energy requirement. Okay, eat what you usually used to eat. Focus on iron, calcium, and protein. That's it. Okay, no need to add more calories into your diet in your first trimester. Okay. So increased energy is required for increased growth and physical activity of the fetus, okay, of the placenta and maternal tissue. You need more calories for your placenta as well. Okay. Even the mother's body size would normally increase. Okay, and there will be more fat deposition. Why the fat deposition is taking place? So that once her delivery is done, once the labor has been done, after that she can this increased fat deposition will be used for milk production. Okay. Slow but a very steady increase in basal metabolic rate will be observed during pregnancy. Totally, we say that by the end of 9 months, the pregnancy weight gain should be between 10 to 12 kg. Okay, mothers should gain around 10 to 12 kg of weight during her pregnancy. And this is for a woman who has an ideal body weight, Indian reference woman whose body weight is around 55 kg. Okay, for them 10 to 15 kg. If the mother 10 to 12 kg, if the mother is already obese, okay, before her pregnancy itself, if she was obese, she had a high BMI, 10 to 12 kg is not recommended. Okay, 7 to 9 kg of weight gain, that is fine with obese mothers. And also ICMR has given the energy requirements. ICMR 2020 has been mentioned on page number 147. Depending on the trimesters, okay, from the second trimester onwards, only 350 kilocalories, additional 350 kilocalories you have to add into the diet. Okay, not more than that. Additional intake of 350 kilocalories in the later half of the pregnancy, that is recommended. In the first half of pregnancy, you don't have to add more calories, only focus on the micronutrients, essential fatty acids, only focus on these things. Okay, macros you don't have to worry about much. What you were continuing, it was, if it was healthy, continue the same thing. Then protein intake will increase. Okay, you have to add at least 23 gram additional protein you have to add. Usual protein intake, we can say it was between 46 to 55, based on the weight of the person as well. Okay, 46 per gram normal it is required. Okay, at least 50. Okay, 46 will be still too less. At least target for 50, you will definitely get at least 46. Okay, so 50 gram of protein should be there in your diet on a regular basis. Okay, but when you are pregnant, okay, during the first trimester, follow the 50 gram rule. 50 gram first trimester. Second trimester, 50 gram plus 9. So let's say 59, or between 55 to 59, almost 60. Okay, almost 60 gram. Add 10 more grams of protein in the second trimester. Okay, that is the fourth month, fifth and sixth month. And when you are in your third trimester, the last 3 months of pregnancy, seventh month, eighth and ninth month, you have to add at least 20 grams more. Okay, so approximately around 70 grams of protein on a daily basis at the during the last trimester. Okay, 60 gram of protein in the second trimester. In the first trimester, have a target for 50 grams of protein. Okay, so 50, 60 to 70. Slight variation is given in the textbook, but when you say 50, 60, 70, it is much more understood. Okay, in the first trimester, I'm mentioning in the chat box. target for 50 grams of protein. In the second trimester, target for 60 grams. And in the third trimester, target for 70 grams. So when you say about if somebody asks you what should be the protein intake during pregnancy for a general population, 50, 60, 70. 50 in the first trimester, 60 in the second trimester, 70 in the third trimester. This will be easier on the practical level. Okay. But for exam purpose, just follow what is given in the textbook. In textbook, they have mentioned 46 gram, at least 46 gram per day should be taken. If it is the second trimester, 46 plus 9.5. Okay. And if it is third trimester, 46 plus 22. Okay. Protein intake changes with weight, not just weight, your lifestyle as well. Okay. If you are a sedentary person, 0.8 gram of protein per kg body weight. This is you have to follow. Okay. Moderate worker, 1 to 1.2 grams. And if you're a heavy worker, 1.5 gram of protein or 2 gram of protein based on the heavy work that you do. So protein intake is more on how much energy expenditure is happening. Okay. What kind of lifestyle you have. Okay. These numbers which I have given is for the general population. At least this is the minimum a pregnant a woman should target. Is it clear to all regarding the protein intake? Visible fat, just 30 gram of visible fat, and out of that 200 mg of omega-3 fatty acid, DHA, docosahexaenic acid, DHA, that is omega-3, a type of omega-3 fatty acid. So during pregnancy, don't go more than 30 gram. Whatever is your trimester, first trimester, second trimester, third trimester, doesn't matter. Don't go more than 30 gram. Okay, during pregnancy, 30 gram of fat intake should be there because you have to increase your fat deposition in the body so that these additional fat can be used for lactation after pregnancy. Okay. But if you are not pregnant, if a woman is not pregnant, 20, 25, 30, very easy to remember. If you don't do any physical activity, you don't have a physically active life, 20 gram of fat on a daily basis, visible fat. Okay, the oil that you take for cooking, the ghee, oil, butter that you take for cooking, 20 grams, not more than that. If you have a moderately healthy, active lifestyle, okay, you work out for 1 hour, 1.5 hour, go for a walk, cycle, brisk jogging and all, dancing, okay, moderate level activities you do, 25 gram of fat you can take. If you are extensively heavy working person, 30 gram of fat you can take. Okay, this is for the non-pregnant woman. Okay, but during pregnancy, whatever is the activity, sedentary, moderate, or active, or a heavily working or active lifestyle, 30 gram of fat you have to take. Is it clear to all? And it's better for protein intake, focus more on milk, meat, eggs, cheese. Okay. These are complete proteins. If you're a non-vegetarian, add more fish in your diet. Fish in your diet will take care of the uh, omega-3 fatty acids as well. 600 ml of milk on a daily basis a pregnant woman should have. 300 ml in the morning, 300 in the evening. Okay. Or at least 250 in the evening and morning, 100 ml you can keep aside for tea or coffee, something like that. But 600 ml of milk should be consumed. And have more legumes, whole grains, nut oil, seed oils, pulses, and cereals. Okay, protein supplements are not required if you follow these diet. If you have 600 ml of milk, if you're having sprouted legumes, okay, soybeans, cheese, paneer, if these things you are having on a daily basis, you don't have to take protein supplements. Okay. DHA is very important because uh, for, for the child's cognitive development, the child's central nervous system development, child's eye development, vision development. Okay, for the health of the fetus's eye, the child's central nervous system, brain, and spinal cord development, DHA is very important. DHA is a type of omega-3 fatty acid. Okay, from flax seeds, corn seed, cotton seed, soybean. Okay, these and also fish liver oil, walnuts, fish, all the fish oils, flax seeds, rape seeds, soya bean, walnuts. Okay, these all are good sources of DHA. Soya bean can be taken by pregnant women. If you are not allergic, you can take soya bean. No worries. It's a really good source of protein. Calcium intake, ICMR suggests an adult woman for 1000 mg of calcium per day. But during pregnancy, slight increase should be there. It was given earlier that slight increase should be there. But now, based on the new recommendation, it is still 1000 mg. Okay, it's not 2200 mg, it's still 1000 mg. But even if you take 1200 mg, there is no issues. You can still, you can still, the body can still manage. Okay. If the if the mother is not able to increase her calcium intake, the fetal bones and teeth calcification will not take place properly. Delay in the tooth eruption for the child is observed after birth. And being physically active, going out in the sun, okay, being in the sun for at least 10 to 15 minutes, okay, these all will strengthen the mother's bone as well, because during labor, during delivery, a strong body, a strong physical body is required to bear down the child. So dairy products are the primary source of calcium. Okay. And green leafy vegetables like agati, gingerly seeds, that is sesame seeds, okay, til, they are also a good source of calcium. And if you're planning for more than one child, avoid repeated pregnancies. Okay, keep a time frame of at least 2.5 to 3 years of spacing should be given. Okay, otherwise the mother's bones will be brutally affected by osteomalacia. Avoid repeated pregnancies as much as possible. Iron intake, earlier it was around 35 mg per day, but during pregnancy now it is around 27 mg per day, 29 or 27 mg per day. This increased iron intake, earlier the old data, according to old data, it was 35. Based on the 2020 requirements of ICMR, it's 27 mg per day. And this iron is required for the increased formation of RBCs and hemoglobin. 40 to 50% increase in the maternal blood is seen. As I mentioned, the blood in a woman's body doubles during her pregnancy, especially during the last trimester of the pregnancy. the amount of blood, the volume of blood doubles. So blood cells also have to double. Okay, so there should be an increased requirement of iron. Okay, and for the blood cells requirement, 400 mg of iron is required. Additional 400 mg. Mother's health will be depleted. Okay, it will become an high risk pregnancy if there is a repeated pregnancy. The mother will not be able to provide good nutrition to the already existing children and also the upcoming children. Okay, both development, emotional needs, physical needs will be deprived. Okay, a pregnant mother may not be that hands on during the initial times or time of a child's age. Okay, at least during the toddler age, a toddler should get complete attention from the mother. Okay, but if the mother is pregnant during the toddler age, it will have some negative effect on the child's emotional needs being met, or the physical needs being met, or even some nutritional needs being met. Okay, so how you can increase your iron requirement? Have more, if you're a non-vegetarian, have more liver organ meat. Okay, dried beans, dried fruits like raisins. Okay, dry grapes, green leafy vegetables, eggs, cereals that come fortified with iron, salt that is double fortified with salt and iron. Okay, sodium, you don't have to you don't need to take any extra sodium. Whatever is your regular sodium, okay, for intake, that is fine, because there is a risk of edema. So increased sodium can accelerate edema. Increased sodium can accelerate swelling all over the body. 400 mg of iron is not daily basis for the entire pregnancy. To maintain an entire pregnancy of 9 to 10 months, 400 mg of iron is required in total, because that amount of iron is required to keep up with the increased blood volume. Is it clear? Why they reduced iron, I don't know, but usually it could be the reason that to keep up with the demand of an iron of 35 gram per day could be near to impossible. Okay, because iron is a very tricky mineral. Even to absorb 10 mg of iron, your body has to go through a lot, like it requires some specific environment. So 35 mg of iron on a daily basis could be near to impossible, that not a healthy woman, a healthy pregnant woman will not be able to absorb that amount of iron on a daily basis. Okay, 29 to 27, it could seem still okay. Okay, that you can eat through your food. Iodine intake, at least 100 to 200 microgram plus 25 microgram. Okay, 100 to 200 microgram is your regular, plus 25, just additional 20 or to 25 microgram is required during pregnancy. But that you can automatically get through salt or other iodine rich food during pregnancy. Emphasis is put on a lot of additional fruits and vegetables. Okay, cereals and pulses. So with that, iodine requirement will be taken care of. If a mother is deficient in iodine, It could lead to abortions as well, congenital anomalies for the children born with some birth defects, mortality of the children during pregnancy, stillbirth, cretinism. Okay, these are the deficiencies of iodine that could lead to issues in the childbirth. Zinc, avoid deficiency, usually increased 12 to 14 gram microgram of zinc is required during pregnancy. An increase of 14.5 to, it is 12 microgram is still less. During as per the new data, it is 14.5 microgram during pregnancy. So at any cost, avoid deficiency of zinc. Vitamin A, have more at least one fruit or one vegetable a day, should be yellow, orange, or red colored. Okay, with that you can maintain your serum retinol levels. Whatever happens, the serum retinol level should not go below 20 microgram per deciliter. So a supplementation of 6,000 to 6,400 microgram, okay, of vitamin A is completely normal. Access of vitamin A should not be given. During pregnancy, you can get an injection done of 2 lakh international units of vitamin A. You can get that injection taken, or a syrup taken. Or if you don't want to take the syrup, have more liver, egg yolk, okay, butter, dark green leafy vegetables. If you're drinking milk, get a packaged milk which is fortified with vitamin A and D. Yellow fruits and vegetables are good sources of vitamin A. Preterm deliveries, malnutrition, severe anemia, both in mother and children. Okay, birth asphyxia. Asphyxia means not able to breathe properly. Okay, so these are the issues during pregnancy because of the deficiency of vitamin A. Vitamin D is highly essential. RDA is around 600 international units for calcium absorption, maternal calcium absorption. Vitamin D supplement can be taken. There is an association seen with vitamin D status and pregnancy complications such as preeclampsia, gestational diabetes, diabetes that happens only during pregnancy, that is gestational diabetes. Okay, risk for C-section deliveries. Okay, because the mother does not have the strength in her bones to bear down the child. Okay, zinc deficiency will lead to immunity dysfunctions, fetal malformations. Okay, the child will not grow properly in the intrauterine growth retardation. Too much of vitamin D can also give complications like atherosclerosis, hypercalcemia. Okay, so too much of vitamin D should not be taken toxic levels, but vitamin D levels is very critical to strengthen the mother's body, her bones, prepare her for delivery, prevent diabetes during pregnancy, eclampsia. Vitamin E, take any polyunsaturated fatty acids. Okay, increased intake of polyunsaturated fatty acids in form of vegetable oil, nut oil, seed oils. Okay, you will get your vitamin E. Vitamin E deficiency can cause pregnancy failure, miscarriage, abortions. And any woman who is having spontaneous abortion, that is miscarriage one after the other, if you improve your vitamin E levels, okay, or you're not able to conceive, you have fertility issues, If you improve your vitamin E level, it could help your with your fertility and the conception. Water soluble vitamins, just refer table 8.1. In any cases, vitamin B complexes, most importantly folic acid. Okay, most importantly folic acid. You should not ready folic acid deficiency will lead to congenital deformity like anencephaly, spina bifida, okay, in which the child's skull is not developed properly, head is not developed properly, okay. Microcephaly, anencephaly, the spina bifida. In spina bifida, a portion of the child's spinal cord is outside, it is protruding outside. Okay, the motor functions of the child's from waist below will be gone for the lifetime. Okay, so these kind of situation, cleft lip, cleft palate. Okay, children who are born with cleft lip, cleft palate, it is because of folic acid deficiency during pregnancy. It has to be corrected, especially for vitamin B. Okay. Any women who are in the reproductive age group should never have folic acid deficiency. It has to be corrected. Supplementation is given during pregnancy also to maintain the pregnancy. Supplementation of folic acid is given. Vitamin C, at least 65 gram is required, microgram is required. 15 microgram as compared to a normal woman's requirement. Coming to the relationship between maternal and fetal nutrition, inadequate food intake from the mother's side will definitely lead to maternal malnutrition. Okay, maternal malnutrition, it is microgram. Ng is microgram. Inadequate food intake from the mother, if the mother is not having proper food, it will lead to maternal malnutrition. Mothers will have malnutrition, and maternal malnutrition would lead to reduced blood volume, increased cardiac output. Okay, blood volume will not be that much. Okay, at least 40 to 50% increase in the blood volume should be there. Okay, that would not be there if the my mother is malnourished. And if the mother does not have enough blood volume, and if there is not enough blood to be pumped into the placenta for the child, there will be less nutritional supply for the fetus. Okay, and when the child has less nutritional supply, placenta will not be there of adequate size, and the child will not have adequate growth. Okay, so that's how mother's food intake is related to growth retardation, okay, or the fetal growth. And especially if the mother is deficient in an energy, okay, she's not having enough calories, she's not having folic acid, vitamin A, zinc, vitamin B12, riboflavin, iodine. Okay, if these specific nutrients are not there in adequate quantity in a mother's diet, it would lead to growth retardation of the child. So, five basic food groups when it comes to food requirements. All the five basic food groups should be included in the mother's diet. Okay, cereals, pulses, milk, dairy products, vegetables, fruits, meat, sugar, fat. Okay, they all are the five basic food groups. It has to be included in the mother's diet. It should be a balanced diet. Nutrient dense food should be given. What are nutrient dense food? That give most nutrients based on the calories. Calories is not much, but it is nutrient dense. It gives you a lot of nutrients like salad and all, legumes, salads, sprouts, germinated legumes, and pulses. 3 cups of milk or equivalent to 3 cups of milk in terms of uh, buttermilk, curd, yogurt can be given. Okay, at least 3 cups of milk should be given. 2 servings of meat and fish or poultry or eggs or any protein source throughout a day. 2 servings of protein sources should be given. Dark green and yellow vegetables on a daily basis. Okay, either fruit or vegetable. Yellow, orange, red, either fruit or vegetable should be there in the diet. Dark green leafy vegetables should be there. Okay, and drumstick leaves are the most common ones that are used during pregnancy. Methi leaves and drumstick leaves. Okay, when a woman is pregnant, even in indigenous cultures of India, drumstick leaves and methi leaves are very commonly given. And generous servings of citrus fruits, okay, to keep up with the vitamin C requirements. Citrus fruits as much as possible. Small and frequent meals, not big meals, because if she is having a stomach full of meal in one go, it will definitely affect her respiration. She will not be able to breathe properly, especially during the last trimester where breathing is impacted a lot. Okay, drumstick leaves can be whatever method you are using, okay, to cook drumstick leaves, don't cook it more than 5 minutes. You can make sabzis out of it. You can add drumstick leaves into your dal once the dal has been cooked. Okay, just add chop and add drumstick leaves into the dal and boil it for just 5 more minutes. Okay, that's it. Add drumstick leaves into whatever sabzi, potato sabzi, or whatever sabzis or dry sabzis that you are cooking. Okay, when there is 5 more minutes left for the uh, whatever curry you are making, it has 5 more minutes are left to for it to be cooked. At that point of time, just add drumstick leaves. Okay, the best way is to add drumstick leaves with any of your legumes, lentils, and pulses. Pulses, lentils, and legumes go very well with drumstick leaves, taste wise as well. Okay. Encourage small, frequent meals. Weight gain should not be more than 400 gram per week. Weekly weight check has to be done during pregnancy. Okay. And per week, especially during the second trimester, second half of the pregnancy onwards. The first half of the pregnancy, you don't have to put on weight. Second half of the pregnancy, start putting on weight, and the weight gain should not be more than 400 grams per week. Okay. Puree of drumstick leaves can be used in rasam as well. Don't use drumstick leaves like curry leaves. Okay. Use drumstick leaves like palak. How do you treat palak? How do you treat methi leaves? Okay. Use drumstick leaves in that way. Drumstick leaves should not be used for tadkas and all. Okay. It is not like curry leaves. Okay. The quantity that you will use should be equivalent how you will use palak, spinach. Okay. Or amaranth leaves. How do you use it? The same way you have to use drumstick leaves. Plenty of water. The mother should be well hydrated. Limit caffeine to 2 cups. She can have coffee, she can have tea, but up to 2 cups only, not more than that. Tea, coffee, and even chocolate. Okay, chocolate drinks. If the mother dislikes foods like milk, okay, focus more on calcium rich food like sesame seeds. In both the edition textbook, I think 400 grams is mentioned, not 450. But 400 grams of weight gain is completely fine. Raw sprouts can be given in form of vegetable salads. Sugar substitutes should be used in moderation, but usually we don't prefer using sugar substitutes during pregnancy because we don't have enough research supporting the use of sugar substitutes during pregnancy. Even for stevia, it applies for stevia as well. So, general dietary problems that you see in pregnancy, dietary guidelines are given that you can read, okay? At least 3 glasses of water, 5 to 6 servings of fruits and vegetables. Okay, these guidelines just go through it. Raw fruits and vegetables should be included, plenty of water, fatty rich food, fried food should be limited. Okay, so the basic guidelines, you can just read through it. Some points are given. So when it comes to nausea and vomiting, okay, under dietary problems, morning sickness is very common in the first trimester, early pregnancy. So that you can improve using small and frequent meals. Okay, don't give too much and try to have more dry food. Okay, don't give a lot of liquid based food. Okay, because liquid foods you will easily vomit it out. Dry food, it will not be that easy. So automatically it will control your nausea and vomiting. If hyperemesis gravidum happens, hyperemesis gravidum is during pregnancy, you're suffering from extensive uh, bouts of vomiting, too much of vomiting. That is hyperemesis gravidum. And in these cases, the mother's throat will start bleeding because of frequent trauma of vomiting. Okay. So in such cases, careful oral feeding is essential. Skimmed milk is better than whole tone milk. Okay. Fruits and vegetables can be given. Avoid excessive seasoned food and coffee. Anything that is strong flavored that can also trigger nausea and vomiting. Okay, so try to give bland food here. And ginger, supplemental ginger, you can give supplemental ginger to the mothers as well. 3 eggs a day is good for pregnant women. 2 eggs a day is good for regular women. Okay. If a woman suffers from leg cramps, which is very common, swelling and leg cramps are very common during pregnancy, it means that she is not having enough calcium and magnesium in her diet. Okay, so correct the calcium deficiency, correct the magnesium deficiency, leg cramps will subside, especially at night. If a woman is suffering from leg cramps at night, usually it is a sign of calcium or magnesium imbalance. Heartburn, very common during the later stages of pregnancy, final trimester. Okay, so it is because the stomach is getting squeezed and esophagus is getting a lot of spills of stomach acid. Okay, so heartburn is very common. So make sure you don't have too much of spicy meals. Okay, tone down the spice. Soon after having any meal, don't go and sleep. Okay, at least 3 hours you have to sit straight, walk around after having some meal. Okay, and then you can lie down. As soon as you lie down, soon after meal, your heartburn will get more deteriorated. Okay, and there are certain beliefs, avoidance and cravings. Okay, for example, raw papaya, consumption of raw papaya during a pregnancy. Saffron, somebody told about sesame seeds. Okay, so it produces a lot of heat. It lead to abortion. These are like beliefs and myths. Okay, some people think that if they consume saffron during pregnancy, it will give them fair babies. So avoid superstitious belief. There are no strong evidence or research under that. Papaya should be consumed, especially the ripe papaya. The yellow papaya has to be consumed. It's a good source of vitamin A. Okay, don't avoid that. Things that you have to avoid during pregnancy is alcohol, smoking, okay, too much of coffee, caffeinated drinks, red meat, okay, too much of spiced canned food, fried food. Okay, these things you have to avoid during pregnancy. And some women will have the cravings for like having laundry starch, ice cube, clay, sand, okay, gili mitti. Okay, these things you will start craving or during because that is called pica. It means that you may be suffering from some micro mineral deficiency. Okay, its pica usually originates out of that. You are suffering from some micro mineral deficiency. Okay, like selenium or trace minerals are deficient in your body. So if you start eating calcium iron rich food or micro mineral rich food, automatically pica will disappear. Weight gain during pregnancy. All pregnancies should be started with the body mass index of BMI. Any woman who comes under the BMI between 20 to 26, you are good to go. You can start your pregnancy. You are ready. You are in the conceptional healthy weight. Okay. And optimum weight gain is around 11 to 13 kg. Optimum weight gain is around 11 to 13 kg. That is in the first trimester. If you even if your weight gain is around 1 kg, the first 3 months of pregnancy, you gain weight of around 1 kg to 1.5 kg, it's completely normal. That should be the average weight gain. After the first trimester, when the second trimester starts, 400 450 gram per week can be gained. 400 is better. Go with 400 because we are facing a lot of obesity related issues in India. So it's better to be on the lower range of weight gain during pregnancy. If the mother is underweight, malnourished, then definitely 450 grams or 500 grams is also ideal. But if the mother is overweight or already has a BMI about 23 or 24, it's better she gains weight around 400 grams per week. If there is a sudden increase in weight, that could be water retention. Okay, that could be water retention. So keep an eye out for that. Whole eggs is better. Whole eggs is better because egg yolk also is a good source of essential fatty acids, vitamin A, vitamin D, etc. Okay, egg is always much better than eating only egg whites. To manage obesity during pregnancy, it's guide the mother to eat nutrient dense food. Okay, nutrient dense food, they give less calorie, but they will meet all the nutritional requirements. Okay, so encourage the mother to have nutrient dense food if the mother is obese. Nutrient dense food means lot of servings of lots of servings of fruits and vegetables, salads, okay, protein rich food. Pica we have discussed. If a mother feels like eating dry ice, mud, chalk, soap, and all, okay, if her calcium and iron levels are corrected, usually the pica will go away. Complications of pregnancy: anemia, very common. In detail, nutritional anemia we have discussed, and we will again discuss in some other class. Okay, because blood volume is increasing, but you're not keeping up with your iron intake. Your iron intake is not appropriate. So enough amount of RBCs will not be formed. Okay, you may have enough RBCs for an adult non-pregnant woman, but that amount of RBC is not normal for a pregnant woman whose blood volume is high. Okay, so automatically you come in the anemic category. Then you have constipation. It's because growing uterus will put pressure on the intestine. It will squeeze the intestine. It will press the intestine. Okay. So that definitely the movement of the feces through the intestine, large intestine, will be very slow. So that's how it leads to constipation. And uh, some types of iron tablets could also lead to constipation. The older generation, the new generation iron tablets does not have that side effect. Physical inactivity will also make elimination difficult. Use natural laxatives in when you are suffering from constipation. Don't go for uh, the pharmaceutical laxative. Use natural laxatives, like you can have isabgol, okay, whole grains, dry fruits, fruits with their peel, vegetables, eat vegetables with their peel. Okay. Edema means swelling. Okay. Mild edema will usually be there, especially on your feet. Okay, because your blood volume has increased. There is too much of blood volume in your body. Okay, but your lymphatic system has a limited function. Okay, your veins are not that capable of fighting against gravity and take care of this big amount of huge quantities of blood volume. So edema will be there, especially on the feet, extremities. Okay, you will have swelling. So sleep with your extremities slightly higher at night. Okay. So that will relieve your edema. Normal edema does not require any sodium restriction. You don't have to stop sodium restriction. To prevent stretch mark, your skin has to be hydrated. Okay. Apply good moisturizer on a daily basis, day and night. Apply good vitamin E based moisturizer, okay, on your stomach. Okay, that will prevent stretch marks. And after applying good moisturizer, apply moisturizer on a damp skin. Okay, when you take bath, at that time itself apply moisturizer on the stomach. And after applying moisturizer, apply any oil that you're comfortable with. Coconut oil, any body oils are available. Cosmetic body oils are also available, just to trap that moisturizer and moisture, just to lock that moisture on your stomach. Okay. So soon after bath, apply moisturizer on the stomach, and after that, apply body oil, and then get out of the bathroom. Okay, do this 2 times a day. You can prevent it. It will not completely prevent stretch marks, but the appearance of it will be prevented. Okay, stretch marks are actually scar that your skin is stretching out and it is scarring. That is stretch marks. Okay. And on dry skin, when the skin is not adequately hydrated, more stretch marks will happen. So hydrate well, keep your body well hydrated, and this moisturization technique, apply this, and you can prevent stretch marks to an extent. Hydration is very important. Hydration and protein rich food is very important, because your collagen is getting destroyed when these scars are happening. Pregnancy induced hypertension. This is increased blood pressure that happens only during pregnancy. Okay. Increased blood pressure that happens only during pregnancy. So during this time, again, a specific diet is prescribed. a sodium restricted diet, but not complete restriction. Okay, because the reason for this hypertension is usually obesity related, overweight related. Okay, so in this case, pregnancy induced hypertension is a complication of pregnancy, and gynecologists will have their strategies planned. They will have the medications planned. Access edema, blood, protein in urine. Okay, and along with that, if the mother is suffering from convulsions, okay, if the mother is suffering from fits, that's what we call as eclampsia. Okay, in pre-eclampsia, so in pre-eclampsia, you will only have hypertension, protein in urine, and hypertension, protein in urine, and then you will suffer from, one second, yeah, hypertension, edema, protein in urine. These things will be there in preeclampsia. And once the mother gets convulsions and fits, that's what we call as eclampsia. Okay, these are the complications of pregnancy induced hypertension. That is increased blood pressure that happens only during pregnancy. So the management of this is done by gynecologist and obstetrician. Okay, and even regular hypertension is managed by the obstetrician. And the main thing here is to control weight, prevention of weight extremes. Even if it is underweight or obese, don't be on any extreme. Maintain your weight. It should not be overweight. You should not be malnourished. Correction of any dietary deficiencies, nutritional status during pregnancy. Okay, it has to be done. Any micronutrient deficiencies are there, it has to be corrected. Okay. Management of any related pre-existing diseases like diabetes mellitus. Okay, these has to be corrected. If the mother was having diabetes even before she got pregnant, insulin resistance even if before she got pregnant, okay, it has to be corrected. Then you have gestational diabetes mellitus, GD. Okay, GD means only during pregnancy you're diabetic. As soon as you're out of pregnancy, you have delivered the child, your blood sugar levels are back to normal. Okay, before pregnancy and after pregnancy you don't have diabetes, but during pregnancy you were having diabetes. Okay, that is gestational diabetes mellitus. It is also not that uncommon, and because there is an increased circulatory blood volume and there is a lot of metabolites in the body, it is uncommon. Okay, and controlling insulin resistance here, having complex carbohydrates instead of simple carbohydrates, doing glucose tolerance test after delivery to revert the woman back to or normal blood sugar levels. Okay, these are the management done by the obstetrician. Any woman who had suffered from insulin resistance before pregnancy, there are high chances, 50% that 50% chances that if you were suffering from insulin resistance, there are high chances you will suffer from gestational diabetes mellitus when you get pregnant. Okay, so correct insulin resistance even before a mother is getting pregnant. And preeclampsia, as I mentioned, the signs of preeclampsia are swelling will be there in the extremities, protein in urine. Okay, urine test will show protein, and hypertension, especially arterial hypertension. That is when we say normal blood pressure is 120 by 80. So what is 120? 120 is your arterial blood pressure. Okay, when the heart is contracting, the blood pressure, what it has, that is arterial. Okay, systolic. And the 80 the 80 from 120 by 80, 80 is the diastolic, or it's a ventricular blood pressure. Okay, so when the upper limit of the blood pressure, if it is more than 140 even in resting phase, we call it as a arterial hypertension. Okay, so if these three symptoms are there, you have preeclampsia. And eclampsia, how it turns to eclampsia, same, blood pressure is there, high blood pressure, weight gain because of edema, protein in urea is there. Okay, same, all these three things of eclampsia is present. On top of it, the mother gets seizures, she gets convulsions. Okay, so that's when what we call as eclampsia. It's a high risk pregnancy. All these are from edema onwards. Edema, not edema, pregnancy induced hypertension, GD, preeclampsia, eclampsia. These all are high risk pregnancies. Coming to the exercise. Okay, in exercise, what you have to do is, for most women, pregnancy, the exercise in pregnancy um, is kind of safe, but too much exercise is not allowed. Okay, normal level of exercise, normal aerobic exercise is allowed. It is beneficial, okay, during pregnancy and for childbirth also. Kegel exercises will be taught to mothers during antenatal visits. Okay, so it reduces the risk of complications you will have, eases pregnancy symptoms, ensures healthy weight gain, and it also prepares your body for labor. Okay, so best pregnancy exercises are brisk walking. Okay, doing Kegel exercise. It is a pelvic floor exercise that you can do anywhere, sitting, standing, anywhere you can do Kegel exercise. Okay, it's just contracting and relaxing your pelvic floor. Okay, and swimming is also good. Stationary bicycling, not moving around with cycle, stationary bicycling, you find that in gyms. Prenatal yoga, okay, a specific yoga is designed for pregnant mother, you can attend that. Jogging for brisk distances, okay, not with complete vigor, with less vigor. Dancing, slow dancing is also fine. These are the exercises you have to avoid during pregnancy. Any contact sport like basketball, soccer, okay, horseback riding, ice hockey, boxing, these contact sports has to be avoided. Hot yoga, okay, this has to be avoided. Skiing. So this is about the exercises. According to the ICDS, Indian pregnant women, antenatal care is given free of cost from by any PHC, CHCs. Okay, all antenatal care are free of cost under ICDS, Integrated Child Development Scheme. Weight monitoring of mothers is also done as a part of antenatal care. TT immunization is done. Tetanus toxoid immunization is given during pregnancy. Okay, one dose of it is given. Weightlifting is not allowed. Okay, during pregnancy. Iron and folic acid supplementation also free of cost under ICDS program. This supplementation is given free of cost. Okay. Health education. Pregnancy is the best time to give nutritional awareness and nutritional education to the mothers. During pregnancy, or even before pregnancy, if the mother comes for family planning, we want to get pregnant. Uh, we are not finding it difficult to get pregnant. Okay, these are the consultation times when it is highly important to educate the mothers about nutritional awareness. Okay, give them health education about nutrients. Okay, so this is the best time. Antenatal means before labor. The entire 9 months is antenatal period. Postnatal means after labor, after delivery. Food supplementation for selected criteria is given. Certain food from Anganwadi, certain food supplementation from ICDS, from PHC. It is given to the mothers so that they can maintain their pregnancy. Okay, it is this food supplementation is not to is not a substitute to what they eat at home. It is just an add on to what they are eating already. Okay. Refer all at risk or high risk pregnancies and obstetrical emergencies to hospitals. PHC, sub centers, community health centers will scan the mothers. If they are a high risk mother, they have pregnancy complication, or they are an obstetrical emergency, immediately they will be referred to a better institution. Mother and child protection card is given, TI card, I card. Okay, different states have their different name for mother and child protection card. Till the age of 5, till the child reaches the age of 5, this card has to be kept properly. Mothers have to bring this card for every pediatric health visits. Then Pradhan Mantri Matru Vandana Yojana is there, in which at government hospitals, the first time delivery, if it is a girl child, they give around 7,000 rupees. If it's a boy child, around 4,000 rupees. Okay, like this, some uh, financial aid is given for the mothers to take care of their labor cost, take care of the post labor cost. Okay, so that's about nutritional and food requirements of expectant mothers.